certificates and say, hey, look what we've actually done in order to prepare for you. I want to say a huge big thank you to our sponsors this evening. Okay, they are Epimex, Natura, and the Expectant Mother's Guide. And we really are just so pleased to have these sponsors participating with us tonight so that we can have as many people learning from the wonderful evening that we're going to have. Our program this evening, we will be hearing from Natura and Epimex, and then we'll be going straight into allergies after that. We will be stopping for a tea and a wee break, and then continuing with the allergies, and then there's going to be ample question time before we finish with the giveaways later. So you actually know that we will be stopping for a tea and wee break. You don't have to worry. We just like to say welcome from the Baby Talk team. Jason, Tammy, and Seth are the ones who are running it behind the scenes. And a really big good evening from me. I'm Lynn Bluff. I'm the founder of Baby Talk and the Expectant Mother's Guide. My background's a nursing degree and internationally certified childbirth educator. And we're really here to provide particularly first-time parents with our decades of experience and proven knowledge to make confident decisions for you and your firstborn. We want you to be able to come out of birth and say, wow, that was an awesome experience. And the way to do that is to actually be well prepared and well educated on the different topics. And so that is why we have formed Thoughtful Childbirth for Everyone. We want to stop and make you think so that you don't actually just, you know, carry on the conveyor belt that somebody might put you on, but actually rather you stop and you think, you ask the right questions, and you make informed decisions.
Because I was like, I don't want to join.
It really is about making informed decisions, and that is what is important. Just to tell you a little bit about what we offer from Baby Talk, that we do the Expectant Mother's Guide and the Expectant Father's Guide. And you can find they're also downloadable as a free app, both from Google Play and the App Store, as well as the Expectant Mother's Guide Journey app. And at this stage, I'm going to ask Tammy, are you available to just run through the app now, or are we going to do it later?
I can do it now. Just give me 3.5 seconds.
I'm going to stop sharing my screen, and Tammy will share her screen, and she will quickly run through the Expectant Mother's Guide Journey app so that you can actually see how worthwhile it is to download and what you can actually benefit and do on it.
Okay. Can you all see my screen?
Yeah, we can see your screen.
Okay. Sorry, guys. Okay. Can you all hear me okay?
Yeah, that's perfect. Thank you. But we've lost the screen now.
Is it back?
No, it says Edge Engineering.
Okay, sorry guys, that's my 10-month-old that's just saying hello to everybody, you know, because it's his bedtime. So yes, this is the Expectant Mother's Guide Journey app, something that we're very proud of. It's been around for a year, so short introduction at the top. If you scroll down, we've got the Expectant Mother's Guide. And here we've got everything from articles. I don't know if it's loading on your side.
Not yet, no.
Okay.
Yeah,
Let's
there we
try
go.
the expectant. Oh man, I think we've got too many things connected. I may have to ask if we can try this again in a little bit.
Okay, yeah, we can do it later. It's fine, Tam. If you can just stop sharing, I'll carry on.
Okay, let's do that. Sorry, guys. Is it back? Am I out?
Yeah, I think so. Okay, Tammy will do it later in the evening when they haven't got so many computers all running Zoom and they've got a bit more bandwidth. Okay, but we will tell you about it later, and in the meantime you can download the Expectant Mother's Guide Journey app and you can be eligible to win a free consult at the end of the evening. The consult's not at the end of the evening, the win is though. We also do the To Mom.me or the To Mommy newsletter, and that's a digital collated newsletter that comes out on a monthly basis via email to our database. And really it's about telling people, pregnant mums and dads, that we know you want to read from the internet, but are you sure that you're actually reading from good websites? And so basically we help you, direct you to really good websites that are evidence-based and the latest research, so that you know if you read from that website, you are reading really good information. And nobody pays us to send anybody to a particular website. I can assure you it's there so that you can facilitate really good information. So you can either sign up by filling out the form tonight and saying you want to subscribe to that and we'll add you to the list, or you can go straight to mom.me and you can subscribe there. There are also consults available with me on choices, on planning your pregnancy and your birth, and actually making decisions during your pregnancy about your birth. So my contact details are down there if anybody wants to know any more about them. And it's really all about being prepared. And so I want to congratulate every one of you here tonight for being here, because this is a huge step to being prepared. And now I'm going to hand over to Dr. Chiquita Foslu, who's a registered homeopath who studied the 6-year master's degree course at Durban Institute of Technology, graduating in 2001. She has been in full-time private practice for the last 18 years, and over that time has developed a special interest in neonatal and pediatric patients and works closely with several private midwives in Port Elizabeth, assisting with pregnancy and childbirth related issues. And so we say thank you very much to Chiquita for being available to speak, and a thank you to Natura to actually asking Chiquita to come and actually speak to us tonight. So I'm going to stop screen sharing and pass it over to Chiquita.
Good evening, everybody. I hope you're all warm and comfortable. I know 7 o'clock is a better time for most parents. Rush hour is over, so if this is your second pregnancy and you already have a small person, I get it. You are, I need to find a way to do the slideshow. Slideshow, this thing needs to move.
Yeah, at the top in the orange bar, slideshow.
There we go.
Yeah, and then from beginning.
There we go. Sorted. Right.
Perfect.
Good evening, everybody. I represent Natura this evening for you guys. I know they've got a really nice hamper, and you can win that at the end of this evening. We're here to talk this evening about how a Natura can help you with allergies. There is a range of Natura products specifically designed for mom and baby. So very often I get a question from new moms, preggy moms, and people intending to have babies. And having had little people and struggled with the first one, and then worried about dealing with the second one, they ask me, is homeopathic stuff safe? If it's over the counter, is it safe? Can I just use it? This range is designed specifically for use during your pregnancy. It's designed for use for tiny babies up to about 18 months. After that, the rest of the Natura range is there, but this is designed for use during your pregnancy. That's what it's there for. And it's ease of use for that. So next slide. This is the medical range. There is an entire range of products specifically designed for problems that occur during pregnancy. And there is a body range as well. So there's a body wash, there's a nipple cream, there's a bum cream, there's a massage gel, and there is a very nice ointment, actually a cream. It's not an ointment, it's a cream for stretch marks. So Natura, bearing in mind that we are designing these products for millennials, we've taken it into account, and how aware you are of environmental concerns. The products contain nothing that is not organic. It is not naturally sourced. There's an EcoCert, all the packaging is recycled, and there's no nasties in it. So there's no parabens, there's no nasty chemicals in any of the products. So as an allergy patient, if you have existing allergies, you can use these products safely. So homeopathic remedies very often come in drop form, in an alcohol base, and people go, oh, that's not good. And you dose tiny people and their face does this, and you're always worried about having alcohol during your pregnancy. So we've solved that problem. They're no longer in a drop form. They now can come in something called a melt. These are tiny little white pills, and they dissolve in a tiny bit of saliva. So if you literally do that and smear them, they dissolve in about 9 seconds. So there is no choking hazard for teeny tiny babies. They taste pleasant, and for neonates, if you want to dose your tiny, you literally dissolve it with a little bit of saliva and rub it on baby's gums. And it's an easy way to dose without any choking hazard. So you're pregnant. Dun, ta-da, yay! And because you're millennials, you are highly aware of how healthy you need to be in your pregnancy. So you're doing the right things and you're eating healthy, but your body is loaded with lots and lots of new hormones that are in overdose during pregnancy. And one of the lovely things that progesterone does to your body is it hypes up your sensitivity to allergens. And people who've never had allergies before in their lives can suddenly develop hay fever and thick, sticky mucus and itchy patches, etc., where they were never sensitive before, because the progesterone makes your body highly sensitive to environmental toxins and things that you may be allergic to. Also, the smell of things. You might have noticed that you become highly sensitive to smells. It's the same mechanism. So allergies are very often something that preggies have to deal with. And the runny nose, I mean, you have so many other discomforts to deal with. Having a blocked or runny nose and sneezing when your bladder already thinks that it's the size of a Tipex lid. Sneezing is not a good thing to add on to a pressurized bladder that wants to burst for nothing anyway. And you go off to the pharmacist, and unfortunately, this is the facial expression you get. Sorry, there's nothing I can give you, you're pregnant. Now, this range is designed for pregnant ladies. So you can send hubby to the natural health section. This is where he needs to go looking. Okay, these are designed for preggies, and there are remedies in this range for allergy symptoms. Starlight is, and you can see my mouse. There's a mom and a baby. This product is for mom and baby. So you can use it for tinies, you can use it for moms. It says coughs and flu, colds and flu. It's for all mucousy type symptoms. These are all the symptoms that it's designed to treat. And you can see a copious watery mucus, sneezing, and allergies. It's all the different forms of allergy. The wet nose, the drips when you go for a walk, and if you blow and there's only one drop on the tissue. It's the most frustrating thing. You've desperately used the tissue for the last 2 kilometers, and you finally get a tissue. Or the lots of sneezing, sore throat that might come from too much sneezing, all of the above. This is your remedy. It's fantastic for treating those irritating hay fever type symptoms. So we can also have that allergy cough. It's incredibly irritating. There are no other cough syrups on the market for preggies because the ingredients are not a good idea. So this is designed specifically to be used during pregnancy and tiny babies, so you can use it safely. I made this. Oh, so you take this tiny Nunu home, and they're so beautiful. And you look in the pram, and they're going like this, and it really does sound like that. This is called Snuffles, and it's when there's a reaction and the baby's nose starts to produce, the lining produces a tiny bit of mucus, and because the little tubies are so small, the mucus can't get out, and it pulls backwards and forwards as they're breathing, and it sounds like it's in a reverberation chamber. There is a remedy specifically for snuffles. Before you reach for that gadget that sucks things out of baby's nose, if humans have instincts that we should listen to, really good ones. It's not instinctive for a new mom to put her nose over her baby's her mouth over her baby's nose and suck. So it's not a good idea to stick in a neonate's nose a gadget that can forcibly suck things out. So we treat the problem. Kotaro is specifically designed for snuffles, and it works very well. Then we have Nunus with allergies. Oh, little people. And you start feeling really sad for them because they hate sneezing. It's very uncomfortable. They can start crying because it's such a surprise. Poor little people with a runny nose. And also this, morning agglutination and delicious green yellow muck in the eyes. Sign that an allergy is happening. That's where you bring in the Starlight. Starlight melts 3 times a day till the problem goes away. Here we go, copious watery mucus, sneezing, allergies, congestion, runny noses, dullness, mental fatigue from the mucus in the nose. Works like a bomb. And tinies with coughing, they really don't like coughing. Ease in cough syrup, even from tiny. Then when you swap from breast milk onto bottle milk, often constipation can happen. Chronolax is there to help treat that. The thing with Chronolax, it's there to treat the type of constipation in little people when we swap over. Also when there's a change in the diet and the constipation happens. Why with allergies, and you're probably going to hear from your speaker this evening, allergies are sensitive to how well the flora in your gut is growing. The better your microbiome, the better your bugs in your gut, the less likely you are to have an expression of any form of genetic allergy. So you want all the bugs you could possibly have, and you want really healthy, happy bugs in your gut, in your pregnancy and in your tiny person. It's one of the reasons we encourage natural birth and breastfeeding. And constipation. So as soon as constipation happens, the bug balance starts to change. So in an allergy family, constipation is a bad idea, and we should be treated as soon as is possible. And that's why we start using the Chronolax. You can use it during your pregnancy. It's for mom and baby. And as soon as Nunus have constipation, it needs to be treated. Right, then, has anyone got any questions? Please put them in the comment section below, and we will be able to help you with that. And I'm going to say stop sharing now. I know I'll be speaking to this group again in a few months. If anyone has any questions that they haven't thought of today, please will you let us know, and we will be able to help you from Natura. So just speak to the marketing team at Natura at any time. I know there's a portal via the Facebook, and they will be able to pass on the questions to homeopath, and we'll be able to help you with any questions that you might have. Thanks so much. Lynn, I'm going to pass it over to you again.
Wonderful. Thanks, Chiquita. You managed that exceptionally well and got an awful lot of information in a very short time. Well done. And I saw people were really, really interested in what you were saying. Thank you for your input. We are now going to move on and hear from Epimex, and I'm going to hand over to Salmarie Fourie, who is the Epimex product manager. And so I'm going to stop sharing, and Salmarie, if you can unmute yourself and start sharing your screen. Thank you.
Good evening, everybody. I must say this is the second time that we are involved in this talks, and I feel like every time I learn something new, even though I don't have children of my own, I do. There's always something that you pick up and take home from this. So as Lynn mentioned, I'm the product manager for Epimex, And I believe that Epimex is the product that no new mother can live without. And I'd like to tell you why we want to say that. So if we look at the importance of skincare in babies and children, the moment that a baby is born into this world, they go through a massive transition from the aqueous environment to a dry environment. Sorry, someone's microphone is still on there. The baby's skin is structured.
It's because you are wearing them, bro.
The baby's skin has quite a different structure to that of an adult skin, in the sense that the cells are physically smaller and the collagen fibers are thinner. About 30% thinner than in an adult's. Also, the composition of the baby's skin is different. So they have less natural moisturizing factors and less lipids, and this can lead to dryness and irritation of the skin. The baby's skin is much more vulnerable than an adult skin, and if you don't care for it properly, the skin becomes susceptible to dryness, conditions such as atopic dermatitis, or better known as eczema, nappy dermatitis, that ugly red nappy rash that we all know, or even infections in the skin. This is probably my favorite explanation of a skin. If we look at the image on the left, you can see that the skin barrier has physical openings in between the cells. And this is what happens in the case of something like an eczema. Whereas the normal skin barrier, or let's call it a healthy skin barrier, you can see that there's a solid line representing the skin, and all the hojas, all the allergens, stay on the outside. I often compare this to a paving. We all know that if a paving is packed properly and the bricks are tightly against each other, you don't see weeds growing in between the paving. But the moment that those bricks from the paving move away from each other, seeds can fall in between and weeds grow out. And the skin works in the exact same way. The moment that the skin is dry and dehydrated, the skin cells move away from each other, and that leaves gaps for allergens and irritants to enter the body. And that causes inflammation and can lead to the development of eczema. Whereas if you put your Epimex on, you recreate that barrier to prevent allergens and irritants from entering the body. There's actually quite a bit of research going on around skincare, and especially skincare and eczema, and how do we go about in preventing that. Almost 50% of children under the age of 2 experience eczema, so that's quite a high percentage. And the skin barrier dysfunction, as I just described, contribute to the development of eczema. There were 2 very interesting studies done in 2014, independent of one another. And both of them showed that you can significantly reduce the risk of developing eczema by using an emollient moisturizer on your baby from birth. So in the first studies, babies with a parent or direct sibling with eczema was moisturized with an emollient for 32 weeks. And the prevalence of the children treated with an emollient was 32% lower than the group that was treated with just the, let's call it, conventional baby care product. So something that's not an emollient cream, a water-based. Emollient is an oil-based cream, so these were just treated with water-based creams. In another study, they extended the reach of the children that they involved in the study. So babies with a first-degree relative with either eczema, allergic rhinitis, or asthma was part of this study. And I saw someone actually commented that they have asthma and now they're scared of the baby developing eczema. So in this study, the baby had a relative, a first-degree relative with eczema, allergic rhinitis, and or asthma, and they were treated with an SLS-free emollient, so something like an Epimex, for 6 months. And in this situation, the prevalence of eczema was 50% lower in the group that was treated with emollient moisturizers. So if you look at these numbers, it's significant numbers, and it shows that the use of an emollient moisturizer can definitely reduce the risk of developing eczema. Amongst children with moderate to severe eczema, 30 to 40% of them also develop food allergies, and 70 to 80% of them also develop asthma and or allergic rhinitis. So if we can protect those little skins and prevent the eczema from developing, hopefully we can stop the whole allergic march to follow. Very interesting on eczema, Dr. Annemarie Goos in Hermanus actually wrote an article on the psychosocial well-being of children affected by eczema. These children show poor self-esteem, they're irritable, they have poor sleeping patterns because they itch all the time, they don't participate in sports and activities, and it actually has the similar effect on the child, on the school-going child, as ADHD. So if you put yourself in that child's position, imagine yourself having a mosquito bite that you found and you started scratching that mosquito bite. The only thing that you can think about is you want to scratch that mosquito bite because it's so irritating. These little bodies with eczema feel like that about their whole body. So they cannot sleep at night. They cannot concentrate at night in the classroom. So it really has a big effect on them. So Epimex is an emollient moisturizer. It has trusted ingredients such as cetamacrogol and glycerine. It does not contain sodium lauryl sulfate, which is a known skin irritant and that can break down that skin natural barrier, as I explained just earlier. It's free from fragrances and colorants. Fragrances and colorants are all irritants in the skin. We do not test our products on animals, and the products are safe to use from birth. So the picture that you see on the screen now is the Epimex Baby and Junior range. It contains cream, which is packed in a 400 gram for your baby room, and a convenient travel size 100 gram for your baby bag. And it contains an Epimex lotion in a pump bottle. Epimex does not at the moment have a soap, but you can use either the Epimex lotion or the cream as a soap substitute and bath your little one with that. The Epimex bath oil, which is this tall little bottle here, contains evening primrose oil and vitamin E. So that's a nice addition to your baby's bath water to just make that water a little bit softer on the skin. You can also use the Epimex bath oil to massage your little baby with. So see that as a little bit of bonding time with your little one as well. Currently, Epimex is the #1 selling and recommended emollient cream on the market, which means this is what dermatologists and pediatricians advise their patients to use. A new addition to the range is the Epimex Baby Bum Barrier Cream. And I know the baby bum or the barrier cream shelf is cluttered at the moment. So why must you choose the Epimex and not one of the others that's been around forever? The Epimex Bum Cream contains allantoin, which is the anti-inflammatory ingredient. It contains bisabolol, which is an anti-inflammatory ingredient, and that aids in the healing of the skin. And it contains dexpanthenol, or provitamin B5, which also aids in the healing of the skin. So the advantage of using Epimex Baby Bum Barrier Cream on that sensitive bum is that should you, and I promise you it happens to the best of mothers, you're not a bad mother if your baby gets a nappy rash. Should you open that diaper and the bum is a little bit red, you clean it properly and you apply a layer of Epimex Baby Bum Barrier Cream. Because of the 3 antioxidant anti-inflammatory agents and the 2 healing boosting agents, with the next diaper change, that little bum will look better already. Interestingly enough, our grandmothers believe that you should plaster on bum cream to protect the bum. The new pediatric guidelines indicate that a thin layer of a good quality emollient moisturizer is sufficient to protect the baby bum. The advantage of applying a thin layer is that you also don't struggle to remove it from the bum, and in the process of trying to remove the cream, damage the bum. So Epimex is not only there for your baby, Epimex is also there for mom and dad. Epimex is also there for very dry, flaky skin. So for the heels, you'll see there's a nice foot cream. So if you need that little bit of extra oomph in your moisturizer, Epimex for emergencies, I believe, should be in every mother's bag. Epimex Ultra Ointment can be used for any skin emergency. If the skin is red, cracked, flaky, irritated, you can apply that. Although it does not say baby, it is safe to use from birth. So should you miss that red bum and it turns into a proper nappy rash, Epimex Ultra will are planning on breastfeeding. We know those nipples can get very irritated and sore. Epimex Ultra makes a fantastic nipple cream because it also contains lots of anti-inflammatory ingredients, and it's also safe for your baby. So you can apply the Epimex Ultra on your nipples after feeding your baby, and with the next feed, baby can just drink. There's no need to remove it or try and take it off and rub there where the skin is sensitive. When babies start to teeth and they get that fantastic red drool rash around the mouth, it's safe to use there. In wintertime, when the cheeks are almost cracked of dryness and redness, you can use the Epimex Ultra ointment on that as well. And when baby starts to crawl and they have those permanent, almost carpet burns on the knees and feet, Epimex Ultra is there for you, don't worry. And lastly, Epimex Oatmeal for that extremely sensitive skin. So if you have a skin that literally reacts to anything, Epimex Oatmeal does not contain any petroleum, and it's free from all fragrances and colorants. Also a whole bunch of anti-inflammatory ingredients to boost that sensitive skin. If you want any more information, please go visit the website that's on the screen now. Please follow us on Instagram and Facebook as we do regular giveaways, and we post a lot of information on there as well. So please make sure that you find us there. I'll be around a little bit longer and see if there are any questions in the comment box, and I might also just leave my email address. Should someone still have a question that they want to direct to me, you're more than welcome. Lastly, Epimex is available from Dis-Chem Clicks and all major retailers. Big advantage, you can actually get Epimex through your medical aid as well. So in the pharmacy, if you take it through to the dispensary, you can claim it through your savings account on your medical aid. Thank you very much, Lynn.
Perfect, thanks, Marie. And I didn't mean to put up the slide while you were still talking, but at least it was the Epimex one. So please, I don't actually know how it jumped onto the screen at all. Thank you again for a very informative talk. I am sure everybody found it very, very beneficial, and I'm sure you will be able to answer some of the questions that have appeared in the chat room. Thank you.
Thanks, Lynn.
Right, and moving on, we are very, very privileged to have Dr. Thulja Trikamjee with us tonight, who is going to spend the evening with us talking. And she is a specialist pediatrician and allergist. She works at the Lung Research Institute at UCT, and she consults in Durban and Joburg as well. And she's here to talk to us tonight on how to decrease the risk of your baby developing allergies. What can you as a pregnant mom do actually to decrease the risk of your baby getting allergies?
Hi, good evening, everyone. Thank you for that introduction.
Oh, just hang on, sorry, I've just got a problem here.
Okay, can you hear me clearly?
I can hear you. Can you hear me? I've lost my screen, but as long as you can.
Okay, and can everyone see my slide? I think maybe you can just pop it into the chat if you can see it. I've got the first slide up.
I'm going to have to.
Okay, I've got that. Thanks, Lynn. Okay, so good evening to everyone. It's so lovely to see so many people online at this time. As you said, I guess this is a good time to get all the mummies and the expectant mummies on board. And thank you to Natura and to Epimex for for sponsoring, but also for such lovely presentations. I actually myself learned quite a bit from both their presentations this evening. So like Lynn said, we're going to be discussing allergy, and since allergy is such a huge topic and it's so much to cover, I decided specifically to stick to food allergy. The reason being that I know many of you are expectant moms, and in terms of the allergy prevention, I think food allergy is something that would be most relevant to you to be up to date with, especially during and throughout your pregnancy. So just by way of introduction, I think Lynn has already gone through this, but I'm a pediatrician and an allergy specialist at the University of Cape Town. So I'm sure most of you know and have heard, and it's probably why there's so many people who are online this evening, that allergies suddenly become such a buzzword. Everywhere you go, someone knows someone with an allergy, someone's had an allergic reaction. There's talk of someone in the class of your child, niece or nephew who's had some severe allergy. And just generally, it's something we read about far more in the news today than we did potentially when we were babies and when we were younger. So just to put things into perspective, I thought I'd share some stats with you. So worldwide, currently, 220 to 250 million people suffer from food allergy. Some of those food allergies can be life-threatening. I will go through the difference between an actual food allergy and many of the things which I as an allergist refer to as perceived food allergy. But many times food allergy itself, if it comes from your immune system, can be pretty life-threatening and pretty severe. The World Allergy Organization estimates that up to 30%, so 30 to 40% of people today are allergic. Now, this could be food allergy, it could be environmental allergy, it could be eczema, it could be a whole host of things. And we don't really have robust stats in Africa today, but in Europe, they estimated that by 2025, that half of the entire EU population would potentially be affected by some allergy, whether it's to food or whether it's something as simple as hay fever. If you just look at some basic stats, right, don't concern yourselves too much with the detail, but the graph on your left shows you the rise or the increase in the United States of food allergies over the previous decade. We're still collating the current decade, and you can see that it's going up. Right? We started off in 2001, 2002 at 3.6%. And in the decade following that, it rose to almost double. We're sitting at 5.1%. And then if you look at some of the common allergies, and these are the ones I wanted to focus on this evening: peanut, milk. I don't think shellfish is too important, but your tree nuts and your egg, you can see that 2%, 1%, 1.4% of all children, that's pretty high. And what that means when translated to you as mummies in your life is if you take each classroom, irrespective of the size of the school, 1% or 2% of every child in every school could potentially have an actual food allergy and potentially have the risk of having severe reactions. So this is extremely important, right? Because up to today, I still see every day in my practice, and I still get referrals, even from medical professionals, of patients who think they have allergies and patients who have been told they have allergies, patients who have eliminated things, adults and children, eliminated things from their diets, but don't really understand what an allergy is. So in a nutshell, an allergy is something that comes from your immune system, right? There are many types of reactions, and I think I've got a few slides to explain some differences to you that you can get to foods. There are tons of different things like toxic reactions, for example, like food poisoning. You could get intolerances, which I'm going to mention later, where you might have some bloating, some gas, some gut issues, diarrhea, vomiting. Those things aren't always necessarily a true allergy. And it's extremely important to be able to distinguish for you as a patient, for you as a mom or a dad, but also for you to know in terms of your family and what they can eat and what they can't eat. Because if it's an allergy, it's very severe and it's potentially life-threatening. And if it's not an allergy, one of the best things about my job is undiagnosing allergies. Because if it's not an allergy, then the amount of anxiety around a specific thing decreases exponentially. And you find that people's health and people's nutrition increases as well. So like the slide says, it's a hypersensitivity disorder. And basically you react upon exposure to a substance. So I'll use an example of a little boy who might be allergic to a peanut, takes a peanut in, eats it, immediately the lip might become slightly swollen. So you see, I'm sure you all have seen pictures of those people who know people with allergies, a huge swelling on the side of the lip, sometimes swelling on the eyes, throat closing, not being able to speak, not being able to breathe, suddenly starting to wheeze, massive welts on the entire body. These are all symptoms, and they usually occur within 1 to 2 minutes and up to 30 minutes after exposure to a substance. Those are all symptoms that you are potentially allergic to something, and things that you need to know if you have someone in your family or a child who has an allergy. So what conditions are regarded as allergies? We already used peanut as an example. So food allergy is our one big umbrella. And we've got the common allergens there, which I'll mention later. And then food intolerances, right? Now with food intolerances, you can see I specifically said reactions to chemicals, because we mustn't mistake lactose intolerance and gluten intolerance as an allergy. Those two intolerances generally affect your gut. They don't come from your immune system. So when we say reactions to chemicals, what we're referring to is the sulfites, the tartrazine, the MSG, the benzoates. Lots of people, you know, you have an extra glass of wine as a mum because you need to look at your own history in terms of looking at your child's risk. You might have a glass of wine, might feel some tingling in your mouth. People who are badly allergic to sulfites can even potentially get wheezing or a tight chest. Things with colorants in it. If you eat excessive amounts of it and those chemicals, that can cause a reaction. And what we also put under chemicals, I didn't classify it separately here, is allergies to drugs. And I think one of the commonest ones that most people might know of is penicillin allergy. Then asthma. Up to 60 to 70% of everyone on earth who has asthma or has wheezed is said to have the allergic type. So we have different types of asthma, but the allergic type, meaning that if you're allergic to, for example, grass pollen, or if you're allergic to house dust mite, you inhale it in, it gets into your nose, it causes inflammation in your nose, and that's when you get the hay fever symptoms. And then that inflammation, if we don't manage it correctly, eventually as the child grows, it goes down to the bottom of the airways, because your nose and your lungs are connected. They're all one airway. When it gets to the bottom, then what you get is reactivity of the chest. When the kids are exercising, you might find they breathing a bit heavily, or they might wheeze when they get a viral infection like a flu. And usually that in time, as they grow older, can turn into asthma. Little kids who always get what your pediatrician might refer to as bronchiolitis, or constantly wheezing, those childhood wheezes, it all starts off with some trigger in childhood. And that's why, as an expectant mother, trying to deal with it and trying to prevent it is such a benefit to your child, because by decreasing the risk of food allergies, in your pregnancy, in the infancy period, and even as your toddler is growing up, you're actually indirectly decreasing the risk of your child even having asthma later on in life. There are huge benefits to it. Eczema, I think this is something common that we all know, and we heard a lot about that in a great study in the Epimex talk, and sinus and hay fever, which I've also mentioned. Another form of allergy, which I think is more prevalent in adults, though we do see it in young teenagers, is urticaria or hives. So those are the little mosquito bites or itchy bites or muzzy bites that lots of people talk about and might get on their skin. Though urticaria can be something that just appears in terms of your skin reacting, But also in children, a commoner cause of it is when your kids wake up from their mattresses at night, or if they've gone for a sleepover, or we staying in a hotel that might have an old mattress, and your child wakes up in the morning covered in welts, scratching everywhere. It happens to us sometimes as well. If we stayed in like maybe an older hotel, then that is potentially related to house dust mite. Some kids might play on grass, they play at school and they do lots of their PT lessons there. And then often they would come back at home and they're busy scratching their legs and scratching their shins. And that's the urticaria related to environmental allergy. Drug allergy we've mentioned. And then another common one I don't want to dwell on, but bee sting and wasp reactions. So allergens can be inhalant, right? And that is how you eventually develop hay fever and asthma. If you're allergic to something in the air like grass pollen, it's in the air, depending on which province you live in. Different ones are endemic. The wind, where I am in the Western Cape, we have terrible wind here. So the wind generally carries the pollen in the air. So even if you have no grass at home, if you just are living in a city or in an area where there are trees, unfortunately in our city, we can't escape it with the mountain in the middle of the city. So the pollen just emanates down, but you inhale these tiny pieces of pollen, it goes into your nose, and then suddenly you get all these symptoms. So all the things which I call allergic manifestations, allergic mannerisms. So like that, or like a click, sometimes constantly rubbing your nose, constantly rubbing your eyes. Your kids may snort or snore at night. Those are all related to stuff they're inhaling. Oral allergies, and that's the food allergy, which we're focusing on today. Additives, which we've mentioned, your colorants, your tartrazines, your sulfites, drug allergies, and venom. This is just to classify them. So let's come to food allergies, which is our focus, right? Shellfish, which is the first one, I'm not going to dwell on too much. The reason being, and this is also something that lots of moms stress about, is that shellfish is not a common allergy for children to develop. Seafood allergies, by and large, we do see them in children, but they're not extremely prevalent. Most allergies develop to foods earlier on in life, but your seafood is one of those few allergies that you can actually develop when you're 20 or you're 30 years old. And we do see many adults developing seafood allergies much later on. Here's the big one now, milk, or what we call cow's milk, right? Everywhere you go, all the time. And I think this is, if there's one message I can drive home, and it's not even my main message, but if I'm not sure how many mums we have, all the 116 parents we have online can get this message, I think this entire webinar would have been worth it, is milk is not to blame for all the symptoms that we get, for us as adults and for kids. It's one of the things that's most commonly blamed. And every day I see patients where either the kids have been snotty or snorty or getting sick all the time, or they're getting perhaps some bloating and diarrhea. Us as mothers and as parents, as adults, we might get some indigestion, we might get extra gas or some constipation. The first thing that everybody looks to eliminate without testing, and sometimes we even do test it, which again, I never do, because testing, as you know, costs money. And if you're already tolerating cow's milk, there's no need to be testing it, right? So milk allergy is extremely specific, and milk allergy is something that will develop when your baby is exposed to milk for the first time. So our bodies and our immune systems are very, very clever. Similar to, and this is the best way to explain it to people now, considering our current pandemic, it's very similar to how the vaccines work, right? Once you have an antibody to something, and once you have a protection, so with regards to allergies, once your immune system is exposed to cow's milk when baby is 6 months old or 4 months old, whenever you're introducing it, whether you're introducing a formula milk, so a cow's milk protein formula, if you're going back to work, or if your breast milk is just not coming in, from then your little one's immune system is getting exposed to cow's milk protein. And just imagine this protein as a tiny little circle. Once the immune system hits the protein, remember what I defined as an allergy. I said an allergy is when our immune system reacts upon exposure to a substance. So when we're exposing our babies to cow's milk when they're under 1 year old, they're being exposed to that substance. If they're allergic to that substance, you're going to see it when your baby's first exposed to it. So at 4 months, at 5 months, at 6 months, at that time, that's when you're going to see the reaction. And the reaction would be all those things. I'm not going to bore you with it again, but the welts on the body, the swelling of the lip, the swelling of the eyes, the tightness of the chest. In a little baby, they can't speak, so you might see some lethargy. They might go pale, they might glue. Those are all symptoms of an out-and-out allergic reaction. Once a human being, and this includes us, once a human being has been exposed to cow's milk and they've already formed soldiers, or what we call memory cells or antibodies, they're not going to then later on develop an allergy to milk. It's not going to happen because you've already got the antibodies. Your immune system already knows what cow's milk is. Your immune system already knows how to process it, and it's not going to suddenly wake up one day and forget. And that's why I say our immune systems are fascinating. They're extremely clever. The same goes for eggs, tree nuts, and your tree nuts are your almonds, your pistachios, your cashews, your hazelnut, which is the Nutella, which is commonly what our kids consume. And then with tree nuts, I also kind of, you know, just put in the legumes. So the beans, the peas, the lentils, because they all fall within the legume family. And then the last one there is your peanuts, and your peanuts is exactly the same. So once you've been exposed to it, you're not going to suddenly get a reaction. And that's why exposure is so important. And that's one of the things that I'm focusing on the talk today. Okay, so what to eat when you're expecting? Unfortunately, because it's a webinar, I can't get all of you to put your hands up and tell me all the myths that you've heard and all the things that you might have been told. But we previously were told that what you eat might cause or trigger an allergy in your child. And I actually saw in the chat box before I started my talk, I think one of the mummies asked a question about whether allergies develop in utero. And the answer to that is yes. I'm going to answer that question now. Allergies don't necessarily develop in utero because, remember, by definition, an allergy is a reaction. And because our little one is in utero, the fetus is not born yet, we can't quantify a reaction. We can't see a reaction, so we can't define a reaction. But in terms of the science, the baby's immune system is starting to develop very early on before the baby's born. So from the end of the second and your third trimester, your baby's immune system is already starting to develop. And because an allergy is a reaction of the immune system, we want that immune system to then, while it's growing, get exposure to whatever they can get exposure to so that the immune system can start developing its own memory and its own memory cells, right? And I'm not going to just tell you to eat everything because mummies are all clever. And I know all of you have access to Google and all of you have access to your smartphones and have access to all sorts of things now. So I'm going to back this up with a bit of science, which you can go and read more about, right? I always tell mums when it comes to Googling stuff, because I know all my patients Google, is it's not something we can stop. And we're living in a digital age, but we're also living with patients who are very informed. You guys are all extremely smart because you have access to this. But if you're going to Google, it must be the correct stuff and it must come from a reliable source, okay? So this was now in 2015, right about the time that I was actually becoming an allergy specialist. So the field was changing in that time. But the allergy and the food allergy world specifically went through a massive change in terms of what we believed was true in terms of food allergy and what was advice we gave to mums. And it made headlines all around the world. As you can see here, one of the morning shows in the United States were discussing the guidelines changing for infants that were at risk of allergy, right? So one of the the holy grails, or one of the organizations which we as pediatricians and subspecialists take much of our advice from, and one that I certainly use and work with, is the American Academy of Pediatrics. So most of the guidelines come from there. So if we go back 11 years now, in 2000, what the American Academy of Pediatrics had said was that solid foods should not be introduced into the diet of high-risk infants. So high risk means if any of you mummies here have eczema or have had eczema, if any of you have had any food allergy, if any of you have hay fever, if any of you have asthma, if any of the dads have any of these things, or if any of you are pregnant with your second child or your third child and your other kids may have had any of these issues, that means that your current baby in your belly is high risk, because there's a risk from patients in your family around you which are first degree. But also high risk also means little babies that might be born with a bit of cradle cap and born with eczema. When they're 4 months old, they're considered high risk if they have eczema, because that means, as we heard in the Epimex talk, that means that they're already at the stage 1 of what we call the allergic march, which starts with eczema and can then develop into food allergy. So any high-risk infants, the AAP said until 6 months of age, it should not be introduced, no solid foods. With the dairy products, and that's the cow's milk, and that's all your cheese and your yogurt and your milk in general, even your milk formulas. Dairy products delayed until 1 year, eggs until 2 years, and peanuts, tree nuts, and fish until 3 years of age. The reason this guideline was made, there were no studies around it, there was no research, because it was based on feeding trials that were done in the previous couple of decades. So not even in the previous decade. This goes back to 1960, 1970, 1980, when I said we never heard about allergies that much. So allergies were not as common as they are now. But it made sense at that time based on those trials. So that is 2000. Now skip 8 years, and this is now in our last decade, 2008. Now the American Academy of Pediatrics changed their statement and they changed their law. Now what they said is, although solid foods should not be introduced before 4 to 6 months, there is no current convincing evidence that delaying their introduction beyond this period has a significant protective effect on the development of allergies or atopic disease. And this was because all the mums were told, don't eat all this stuff. But peanut levels just kept rising. You know, in the first graph that I showed you, we were finding that we were almost reaching epidemic levels with food allergies. So we realized this is clearly not working. And when we went back to the science, we realized that the science was not really making any sense. So enter 2015. And in 2015, a landmark trial was published in the New England Journal of Medicine. And what they did in this trial was, if you just look at this, is quite a busy, complicated slide, but if you just look at the fact that one arm of this graph is green and the other arm is red. So what they did is they took a whole bunch of kids in the United Kingdom, and United Kingdom is pretty key. And I see from the mummies here that we've got mummies from all backgrounds, right? So United Kingdom is pretty key because United Kingdom is a melting pot of all races and all cultures. As you know, we have different risk factors in terms of our different races. Like me being Indian, I am high risk for cardiovascular disease. I am high risk for cholesterol just because of genetics, right? So they said, well, we can't do trials on specific types of kids like it was originally done in Israel. And we can't tell everybody in the world, because this was done in Israel. So we can't tell everybody in the world, you know, you guys all should start eating peanuts, because what if it's only Israeli children that this works on? What if the Israeli children only have this issue? And that's an interesting story. I think most of you might enjoy that. Just a quick interlude on why the study, or the thought of the study and what happened, was that one of our allergy colleagues went to work in Israel, in Jerusalem, and he was working in the allergy clinic, and he couldn't understand why you saw so much of milk allergy. We saw tree nut allergy, we saw egg allergy, but we hardly saw any peanut allergy. And then what we found out on investigation was that kids in Israel, in Jerusalem, were being given handouts of a snack called bamba, which is very cheap. So it's readily available to everyone, but it's one of those snacks that's handed out even in government hospitals. And bamba is made up of peanut protein and peanut flour. And nobody was actually checking who was allergic in Israel. Nobody was checking which kids were high risk. Every child was just given free bamba. And as you know, especially among the lower socioeconomic groups, you're going to take what you're given and you're going to feed it to your children. So what we did there was we took a whole bunch of kids in Israel and we told them, don't eat bamba. Everybody else had no allergies because they were eating peanuts. And we said, don't eat the peanuts. And the allergy levels started going up. And that made us realize, wait a minute, we've been telling everybody, don't eat the nuts. But actually, the place where the allergy is the least is the place where they're all eating nuts and they're all getting the nuts for free. And when we stop giving them the nuts, their allergies go up. So we need to assess this properly. So coming back to the slide, if you look at the green arm, kids after 4 months, so that's key, right? Because I know all of you have been drilled to be told 6 months exclusive breastfeeding, right? So kids after 4 months who were given peanut flour or peanut protein in the form of peanut butter or a snack were on the green arm, and then children were told, or mums were told in the red arm, no peanut. In your kitchen, no peanut, throw the peanut butter bottles away. There must be completely no exposure. And what they found is that if you look at the graphs, the bars that you look at basically tell us how allergic or how many children were allergic, right? So all you need to know is all the green ones are the ones of children who are being given peanut. Right across the board, all the kids in this study in the UK who were eating peanut butter 3 times a week had, so if you look at the first cohort, 1.9% versus 13%, right? 10.6% versus 30%, right? So categorically it showed that if you gave properly peanut butter to little babies when they're extremely young, you primed their immune system to get used to the peanut flour, then you're not actually going to make them become sensitized. You're actually going to be making them tolerant. And the message from this entire study was that our exposure was key, okay? And giving children that is definitely more beneficial than avoiding it. So what does high risk mean, right? I think I've touched on this a little bit already, but high risk means family history, which I think we've already gone into. Early atopy, and early atopy is defined as the kids who grow up or the babies who have cradle cap when they're born. The feeding history, so those who've completely avoided a whole bunch of stuff and they've not been exposed to it. Mommy avoided everything perhaps while she was pregnant as well. That might potentially put them at high risk because we don't know what's going to happen when they get exposed. If they have symptoms and signs, so sometimes some red bumps on the body, eczema on the rest of the body, not just the cradle cap, a past history of a reaction, and then also some other non-skin and non-food related conditions. Now, we talked about what's important in terms of when you're pregnant and why feeding is better rather than avoidance, right? But once you do suspect, or if you're one of those mummies who's afraid, you know, you're not sure, you don't know, can I give my baby the peanut butter? Because that's a real anxiety. If it's never been given before, and I'm just telling you as a general rule that it's better to feed them, we're not there with you at home when you're actually giving the peanut butter, and there's an anxiety related to that. So coming back to why knowing the difference between an allergy and an intolerance is important is because when the allergy forms in your immune system, one of the main organs that's involved in this is the skin, because the skin is part of our immune system, and we take advantage of that as allergists by using the skin to test allergies. So especially in your little infant, if you're in a position where you've not avoided stuff while you're pregnant, you've got your little baby now, and you're not sure what to do, and you're afraid to give your child something, right? Rather than avoiding it, what I would recommend is go to a doctor and get a skin test done. If you want to give it peanut, you want to give some scrambled egg, you want to give a little bit of cow's milk, get a skin test done. And if the skin test is completely negative, this can be safely introduced to your baby. In fact, what I do is often in my rooms, I would do a skin test, and I keep, obviously we can't do this during COVID, but pre-COVID, we would keep bottles of the jar of the Nutella, the peanut butter. We always have fresh milk. And if the skin test is negative on the day in front of mommy, we feed them this. And what you've just done is you've done two things. You've firstly known for sure and excluded this potential allergy in your baby, but you also expanded your baby's diet to involve a food that may potentially be very important in their development and their growth. And basically how a skin test works, if for those of you who might have not seen it before, is we have the reagent in a bottle, we put it on the skin, we then prick the skin, the top layer of the skin. It doesn't really hurt your baby. It feels like a mosquito bite. No blood is drawn. And then we wait to measure the reaction. Sometimes we do it to reagents, but if it's a day that I want to give the food to the baby, I might actually just take the peanut butter or take a teaspoon of fresh milk, just pour it onto the skin. And that's what I call a skin test or a prick-to-prick test to the fresh food. Okay, before we go through the allergenic foods and go through each one specifically, let's just do a time check and see if Lynn wants to do our little tea and wee break now. And I think then we can go through to each food separately. I'm sure you guys are all wanting to stretch a bit or maybe grab some water or grab something to drink. Lynn?
Perfect. Thanks, Thulja. And it's just so fascinating, but I'm sure these priggy mums and dads want to just stand up for 2 minutes, go and grab something to drink and go and have a wee. So we will break. It's now 8:09. We will come back at 8:19 and we will continue. So don't go far away, just go far away enough to be refreshed, and we'll see you back shortly.
Okay, so getting to the allergenic foods now. We thought we would go through each one of the ones that we know are potential dangerous foods, but at the same time, ones that if we act earlier on in baby's development would have a potential benefit to them. And one of the biggest ones we hear about and we see all the time in schools, in cafes, in restaurants is the peanuts. So we also see them in movies, there are books written about it. So peanut allergy it has been considered by the World Health Organization separately as a burden, a huge burden, because every year we hear in the news, fortunately, it's not too bad in South Africa in terms of the mortality, but we hear every year in the news that some child accidentally consumed peanuts somewhere, be it in a sandwich or by accident in Thai food or in a sweet or in a chocolate, and sometimes the consequences have resulted in death. So it is regarded in childhood especially as among the most severe food allergies. It does have the potential to result in death. It is something that can be outgrown, but it's not always outgrown. And that's why prevention is better than cure. And that's what I'm always telling my patients. But also that's why it's so important to be correctly diagnosed. Like I did mention in terms of the mechanism of the allergy, it usually presents the first time your child eats it. And you're going to know at that point whether your child is sensitized or tolerant to peanuts. And here's something that lots of moms probably are not aware of unless you've had a child with allergies, that peanut exposure is not only the peanut that you eat. It can actually occur through oral, which is how we eat it, or through skin exposure. So for example, and we've done this now in the last year, we vacuum up dust from pillow covers and from bed sheets from homes in certain parts of the country, and we tested it for a whole host of allergens, peanut being one of them, and we found that there's a large concentration of peanut protein even in our bedding. So it's so important, and this just reiterates why measures to decrease the risk of allergy are far more important than getting the allergy and treating it. Because if the peanut protein or the peanut flour or traces of peanut are in dust in the air, they're in dust in our upholstering, so our sofas and our mattresses and stuff, it's extremely difficult to avoid it. And if your child is very allergic, and when I say very allergic, like extremely, extremely allergic, they could react just from touching the peanut on their skin. Another important thing to know with regard to the skin exposure is eczema. And this is also something that lots of people struggle with. It's something that's extremely frustrating. It's something that has lots of social and emotional aspects to it, and it has a burden even financially to patients and to parents in our case. But the eczema, sometimes when you have a situation where you do everything, you go to every dermatologist, you go to every doctor, you buy the most expensive creams, and the skin is just not getting better 90% of the time. And usually I see these patients right at the end when they've already gone through so much. You realize that it's likely something like a food, like peanut, that they're constantly being exposed to, and that's what's driving their eczema, and that's what's driving their allergies. And that's why I think we heard it in the previous presentation, but getting the barrier to be nice and strong is extremely important. Because when your child's skin barrier breaks down, that's when things like the peanut or the egg protein in your skin, in towels, in your kitchen, on all of our cutlery and our crockery, when your child touches that, it goes through the barrier of the skin, and that can trigger off a reaction. So that's the other way that children with peanut allergies can present, just with extremely bad, frustrating, difficult to treat eczema. And then the other thing also is inhaling peanut. So with inhaling peanut, it's not going to be the same as people who inhale pollen or people who inhale dust and smoke. They're not necessarily going to get hay fever. But in a child who's badly allergic, extremely, extremely badly allergic, where their levels are out the charts, then if they inhale peanut, they can actually potentially even have a reaction. We already know that early exposure is proven to decrease the risk, but I want to focus on the one where I've got the exclamation, and that's the generally outgrown. And this is the piece of good news. I think I've given you guys too much doom and gloom by telling you how many people have allergies and how it's become a pandemic and how too many people have it, and its levels are increasing and stuff. But the good news is that with all this science and all this data that we have, and with medicine evolving and the field of allergy and immunology evolving at the rate it does, the good news is that if you have a child or a family member who has a specific allergy, and peanut is one of them, they don't have to live with it, right? And this is why it's so important to diagnose it correctly, to see the right doctors, and to manage it appropriately. Because what happens with many of these children is that as they grow older, their levels potentially drop because they become less allergic as their immune system is developing. So most children who even have cow's milk allergy when they're younger, as they grow older, they run out, or they run out of those antibodies that cause the allergy, so the allergies decrease. So with peanuts, it's very, very similar. You often find lots of moms who might say that my kids had all these bad food allergies when they were young, they had the eczema, they had the whole toot, and now they're eating everything. Now, those are the few and far in between ones where somehow the kids got exposed to it, the levels were tested, and then they started consuming it. So if you've got a child who has a peanut allergy, say your infant is 2 or 3 years old, don't think that this is a lifelong sentence, because that also has very emotional implications on you as a mom, and it has implications on your baby as well emotionally. I'm going to mention that at the end of the presentation, but for a child growing up with allergies is not easy. We see what we see at home, but they have to go through school, and they go through university, and they have social gatherings, and they have girlfriends and boyfriends and friends. And it's not always fun to be that one child who can't eat the cake, and that one child who can't eat the donut, and that one child who sits separately when it's someone's birthday at school. They get teased. So when you can prevent the allergy, and once they do have the allergy, those levels need to be monitored. Depending on the patient, I monitor the levels in my patients every either 12 months or every 18 months. And if the levels start decreasing, I would call the child into my rooms and I would conduct what I call an oral food challenge. And what that simply is a protocol that we follow from Europe, where we give the child small amounts, slowly, small amounts of the peanut over a period of time to ensure and prove for beyond any doubt that this child can tolerate peanuts. And you basically then, at that point, are free to consume peanuts at your will. And you've now cured something that's potentially having a huge burden on everybody in the family's quality of life. Milk and dairy, right? Most common allergy of infancy, right? I think we all know that. We all hear about it. We all know people who have this allergy. We all know those babies who get taken to the pediatrician all the time and they keep flipping, and they've bought so many different tins of the milk formula and they've tried each one. The more they try, the more expensive the tins get, and you're just not coming right. And then suddenly one day the child's fine, right? It's not necessarily an effect of anything you're doing wrong. It's not an effect of the milk not working. It's what it simply is that milk allergy is not something that lasts in infancy. It's something that they usually grow out of. I think I've already mentioned this, it's overdiagnosed, right? This is obviously my opinion from my patients here in South Africa, but this has been internationally proven. It's allergy to a protein. So when we look at milk allergy, what I would test is the cow's milk protein. And in this case, we test something called casein. I have seen many patients from all around the country who were concerned about milk, who went to their doctor, they got milk tested, but it wasn't the casein that was tested. It was a different type of protein, or it was something else that was tested. It was the whole antibody, and that can sometimes give you false results, right? And majority of them are outgrown within the first year of life, first 5 years of life. Well, actually, the majority are outgrown within the first year, and then we usually say up to 80 to 90% within the first 5 years, right? Again, to reiterate this, because I know this is such a problem, right? Symptoms of cow's milk allergy: a rash, like I mentioned, the eczema, swelling of the lip, the tongue, the eye. It usually presents on the first exposure. So your baby's not going to be drinking milk, having custard, having cheese, having yogurt, and suddenly start developing a milk allergy. Our immune systems don't work like that, okay? So it usually presents on initial exposure. Gastrointestinal symptoms, and that's what I mentioned before, the bloating, the gas, the cramps, that is not a milk allergy, right? That is not a symptom. And especially when you feel like, okay, I've had too much milk, or I've put too much milk in my coffee, so the next morning I'm a bit constipated, or the next morning I've got runny stool. Remember, an allergic reaction is an immune-mediated reaction. You're exposed to something and your immune system reacts immediately. You're not going to then get diarrhea 24 hours later. That's not going to be classified as an allergy. And in severe instances, babies can have respiratory symptoms. So this is just something interesting that I like to share with mums. So just so you know the science behind it, in some parts of Europe, what they did is they telephoned 44,000 families, right? And well, participants, they got far bigger families, but the ones who gave consent to have their data be put into the study. And they looked at how many people claimed that they were allergic to milk, right? And they found that when they asked people, do you have any allergies in your family? How many people in your family have allergies? How were your allergies diagnosed? And what allergy was it? Was it milk? Was it nut? Was it seafood? We found that milk was the biggest one, right? So this is not just among us. We have this perception that milk is a cause of everything, but this is something that mums everywhere are afraid of and anxious about. In Greece, more than 10% of all moms that were contacted that gave permission to have their data included said that they think that their child or they have a milk allergy. In Finland, which is a first world country, 52.3% of people, of Finnish people, think they're allergic to milk, more than half their population. And they found that it was the most common offending agent in children, and it was the second most common in adults. In adults, they found that seafood was a huge one. Now, if you look at these rates, right, I'm just going to go back to the previous slide, right? 13% of Greeks think they're allergic to milk. 52% of Finnish think they're allergic to milk, right? These are actual rates from proven, right? Blood proven, allergologist, immunologist proven, and challenge proven rates, right? In preschoolers, it's 0.5 to 2%. In younger children going up to teenagers, it's 0.5%. So you can see it drops, right? And in adults, it's less than 0.5% of the entire world. And this is from the World Allergy Organization and the World Health Organization actually have a true allergy to milk. Okay, so I'm going to say this again. If there's something you can take away from this, right, is we shouldn't be anxious about milk, and we shouldn't be blaming milk every time we have some symptoms. We must test it because milk is extremely, extremely important, right? Another important thing that milk gets confused with a lot, because this is common, is lactose intolerance. Okay, we all hear about lactose intolerance every day, right? So what lactose intolerance is it's basically a sensitivity to a carbohydrate. So when we look at milk allergy, what we're actually looking at is, I mentioned to you the protein, right? If you're allergic to milk, you're allergic to cow's milk protein. When your immune system comes into contact with it, your immune system is just going to react. Lactose intolerance is completely different. It's a reaction to the carbohydrate. And what happens with lactose intolerance is that there's an enzyme, the lactase enzyme, that's lacking in the gut. So when you take in the milk, right, and the carbohydrate hits the areas of our gut can't break it down. The enzymes are not there to break it down. So you've got all of this bloating, and you've got this heaviness, and you've got it sitting on your chest, and you've got it sitting in your tummy. And then that's when you get all the different things. You get the cramping and the diarrhea and the constipation and the bowel changes, right? But it's not coming from your immune system. And that's why you don't see a swollen eye with lactose intolerance. You don't see a swollen lip. You don't see wheezing. You don't see hives or a rash in your entire body. Extremely important, if you look at the left part of the screen, lactose intolerance, the first, second, third, the fourth statement, rare in young children, right? I have seen children with it, but this is extremely, extremely rare. It is rare. We often find that there are so many children who have been told also, you know, you must be lactose intolerant. Lactose intolerance is generally young children, meaning 13, 14, and they go into the teenage years, and it's young adults as well. It's not in young children. And the other difference, and why it's so important to distinguish, right? Because as moms, honestly, I don't think the diagnosis is something that affects your life. I always tell my patients that whatever we do for you mustn't just simply be about putting something on paper and telling you this is your diagnosis, or giving you an allergy test result and saying this is positive. Whatever we do has to impact your quality of life. Now, the reason why it's so important for you to know the difference between lactose intolerance and milk allergy is that if you're allergic to milk, you are going to outgrow it. You're likely to outgrow it, but also you can't tolerate milk at all. Babies who are highly allergic, the minute they drink the milk, while they are allergic, the minute they drink the milk, they might have a reaction and you might see an issue, right? Whereas with lactose intolerance, you find those patients who say, sometimes when I had the milk, I was okay, but sometimes when I have the milk, I'm not okay. At times, it doesn't affect me, and at times it does. I put a bit of milk in my coffee and it's fine, and I put a bit of milk maybe in my cereal and it's not okay. Or if I have yogurt, it's fine, but if I put the milk in my tea, it's not fine, okay? And that's because depending on your enzymes in your gut, sometimes they break it down because it might be a slower process, or the type of the milk that you're drinking might be more broken down, and sometimes it's slightly heavier. If you're allergic, your immune system does not care how heavy the milk is, your immune system is going to react to the protein, okay? The management for proper milk allergy, the first thing is, if you're highly allergic or your baby's highly allergic, is avoidance of cow's milk. And that incorporates your cow's milk formulas. So all the ones, I'm not going to mention brand names on the webinar, but all the ones we get in South Africa, which we use at our stores at Clicks and Discount that we go by, the general ones, right? You get them at all different price ranges. The general one that says cow's milk protein formula, those have got cow's milk in it. And then if there's an allergy to that, we often put a baby onto soy formula, right? And then this is something that lots of people have been through as well. You get different types of milk for allergies. There's some that call themselves hypoallergenic, and they look at basically how broken down the protein is. We as allergologists don't really believe too much in the hypoallergenic milks, right? We like the milks where either it's going to treat and make you avoid the milk allergy, or you're going to be tolerating the full amount of milk, okay? So when we look at the milk, we look at hydrolyzed formulas, and we usually look at something which we call extensively hydrolyzed. So those of you who might have bought tins might have seen this, but it says extensively hydrolyzed, and that's what we use. There's some that call themselves partially hydrolyzed. And if your baby, here's a rule, if your baby is drinking partially hydrolyzed milk and you're happy with that, that means your baby is not allergic to milk, because a baby who has a bad allergy can't tolerate that, okay? And then your amino acid formula, right? And the amino acid formula is like your neocates and your pepticates, where the milk proteins are really, really broken down. So basically what they do is say if your milk is a big bowl, they've just taken a whole lot of processes. It's almost, I tell moms, it's like taking a jackhammer, crushing the bowl or crushing a nut, putting it in small pieces and boiling it so the proteins are denatured, and that's where they're able to tolerate it. Okay, I'm sorry. I don't know what happened here. I think I seem to have pressed a wrong button, okay? So just always know that when it comes to the milks as well, if your baby's been put on a specific milk, you shouldn't have to be using that milk all the time. There should come a time that your baby should be, as a stepwise approach, or what we call a milk ladder, now start taking stronger proteins. And as they start taking stronger proteins, that is now what you're doing is you overcoming the milk allergy, okay? Eggs, right? Another extremely common one, right? It commonly develops second after your cow's milk allergy. There is a strong association with eczema, like with milk and peanut. And babies that are allergic to eggs, right? When the allergies are really bad, we say no eggs. Everything needs to be egg-free. But with them as well, based on their levels, we assess their levels as allergy specialists, and based on their levels, or if their levels start decreasing over a period of time, what I do is I then introduce what we call baked egg into the diet. So I might tell mommy, no scrambled egg, but bake a cake or a cookie or a muffin. And if you put the egg into the batter, because the egg is being put into the oven is denaturing the protein because it's cooking for 40 minutes, 45 minutes in the oven. Your child can start tolerating baked egg. So egg is something as well. Don't think of it as a life sentence. Most patients I know, more than 90% of patients that I've treated have all completely overcome their egg allergies, right? And egg, again, exactly like the peanut, react with the skin as well. So you might get the eczema, right? So I think I have stressed this enough, right? In terms of your take home message for not just pregnancy, but also once your baby is born, right? And I always tell everyone this, I get teased about this by my patients, is expose as much as you can to the foods, to dirt, to grass, to sand, from the time you're pregnant. Even with you, get exposed to stuff. I know it's difficult during the time of COVID because we're trying to stay indoors, and especially if you're pregnant, you want to protect yourself as much as possible, but walk on the grass if you don't have the allergies. Make sure that you get exposed to the pollen, go out, get the fresh air, because your baby's immune system through the umbilical cord is getting all these proteins and getting, even if it's tiny, it's trace amounts, but over a period of time, that builds up to what we call exposure that can institute or can cause tolerance, right? So eat healthy, I think that's a given. Do not smoke. Smoking has been proven time and again to increase the risk of allergies and asthma. Do not exclude any specific food thinking it will cause allergy, right? Unless you're allergic, right? If any of you have allergies to any of these things, you need to protect yourself first, right? Assuming you have no allergies, don't avoid anything thinking, oh my gosh, I want to stay away from this. Eat plenty of dairy, egg, and nuts specifically, right? I've shown you the data, I've shown you the studies, it's been proven, right? When baby's born, like we always say as pediatricians, breast is still the best. Use the emollients. You got the presentation before me, and I think it was wonderful to help the skin barrier, because the skin barrier, when it's compromised, the allergens go in and it triggers off the food allergy to become worse, but it also makes the eczema worse. When your child, you can wean your child, right? So this is, I do this with my patients. I know there are some pediatricians who are not still practicing this robustly, but this is completely up to you, okay, and your pediatrician. I've given you the evidence, and I certainly, with my patients in the private sector, I tell mummies, and I successfully do it with hundreds of patients, where we introduce the solids as early as 4 months. And the way I do it is I tell mummies, a little bit of peanut butter in the cereal 2 to 3 times a week. You're getting that peanut protein in. And again, I've shown you the data, I've shown you the graphs, and I've shown you that those babies who got it from 4 months, they had less allergies than the ones who were kept away from it, okay? Introduce these things as early as possible if you can't do it at 4 months, and do not avoid exposure to environmental allergens. That is your grass and your pollens and things like that. I just have one case study just to, of a common, very common scenario that I see, and maybe I think probably half of you have either experienced it yourselves, or you might even know somebody who's experienced this, right? 6-month-old baby, exclusively breastfed for the first 6 months, and then you suddenly introduce milk, and the baby's vomiting and starts having runny stools, right? The baby immediately gets, mom obviously is in a panic, rushes to the doctor. And when I say you introduce milk, it means, you know, now you want to start getting off the breast, you're going back to work, you buy a nice formula, you buy the top of the range formula, you give it in vomiting, running stools, right? So you rush to the doctor, and the doctor says, no, this was, you know, she reacted to, or he reacted to the cow's milk formula. He's allergic to cow's milk. And then you immediately get changed to soy, or the one that I said is a hypoallergenic formula. And then there's all the other milks as well, you know, the goat's milk, the sheep milk, the almond milk, which we all see everywhere in our organic stores. And you were advised to be careful with introduction of other things, which is your peanut, your egg, and your fish, right? This is a scenario that we see all the time, and it's a very realistic one, right? Now, the problems with this, right, with the data and the evidence that we have now, and with everything that we practice as allergy specialists, is that if your baby is not allergic to milk, and remember, runny stool is not a reaction to milk necessarily. No one's done a skin prick test, which I showed you about, to see, is this infant actually allergic to milk? What's the risk here, right? So if we avoid the milk, right, we're keeping the baby away from it in the diet. The child is growing at a crucial period. Remember, our babies are growing, their bones are growing, their teeth are starting to sprout. All these things require calcium, they require vitamin D, and all of these things are extremely important for the growth of many of the tissues. So they're not getting enough vitamin D and calcium, right? If they're not allergic. They're avoiding the allergenic foods potentially, and if you avoid it, remember what happened in Israel and what happened in the London study. If you avoid it, you potentially are causing more harm, because you potentially just leaving this immune system so that the immune system is not going to be primed. So you're potentially increasing the risk of allergy in your child. As he grows, your baby grows, and hopefully the baby does outgrow it. We won't be assessing it all the time. So you're just going to avoid it, and we won't know when is the right time. And then obviously, if it is in fact a severe allergy, and this is very important, right? Because I've given you all the stuff about non-allergies, but the allergies are equally important. If your baby is severely allergic to any of the foods we discussed today, they have to be managed properly. You need to have an EpiPen. You need to know how to use the EpiPen. You need to know what to do in the case of a bad reaction. You need to know how much of Allergics to use. Is Allergic safe in your baby? If your child is going to school or to creche, the drugs need to be in the school bag. The teacher needs to know how to monitor this. In little kids who can't speak, a medical alert bracelet needs to be carved out. So all of these things need to be addressed. It's not as simple as, okay, somebody's reacted to something, let's now diagnose or label them allergic and let's move on. And that's how all the accidents happen, okay? Especially some of the ones that we see overseas. Cost to you, right? If your child is potentially overdiagnosed or misdiagnosed with a milk allergy, right? Cow's milk is 12 Rand a liter and almond milk is 52 Rand a liter. So if you have to calculate how much this is going to cost you, not everyone can afford this. And when you're totally avoiding milk, this is just the fresh milk. It's the yogurt, it's the cheese. You're going to have to go get everything free of cow's milk. And like I said, if there's a proper milk allergy, then the cost is not an issue. But if you're doing this and your child's not truly allergic, then this is definitely a consideration that you're giving a milk that you don't potentially need that is 3 times the price. And over a year, that's exponential, the effect that it has on your pocket, right? And just to end off the talk on a light, I wouldn't call it light-hearted, but just a nice way to explain to you why I'm so passionate, and we all are, I know Lynn is as well, about correct nutrition and preventing allergies in babies and in children. Some of the struggles which only people with allergies really understand and what they have to live with, right? We don't realize, moms who have kids with it know that if you have a peanut allergy, it's not as simple as avoiding a peanut. It's not that simple. As doctors, the doctor will do the test and then just tell you, no, the peanut level is high, and sometimes the correct protein might not be assessed, right? But we're not just checking the actual protein, and sometimes if it's diagnosed incorrectly, or even if it's diagnosed correctly, right? If you're now going to be told you need to avoid peanuts, it's not as simple as avoiding peanuts. Every time you pick up a chocolate, every time you go to a restaurant, every time you go anywhere, all those labels, you have to read peanuts everywhere. The foods that have peanuts sometimes, I mean, which kid wants to stay away from M&Ms, and which kid wants to stay away from some of the tasty spreads that have peanuts in them? Again, and this is why we discussed some of the commonest ones. We discussed milk, we discussed egg, we discussed peanuts, because they all kind of go hand in hand. And that's why treating them or eliminating or excluding them earlier is better, because generally you really find a child who only has one allergy. It's generally 1 or 2, or it's asthma plus peanut allergy, or it's eczema plus egg allergy. So it's all combined together, right? Those may contain labels. And this is what I was talking about in point number 1, is every time you pick up a chocolate that says may contain traces of, there are actually some laws now in the United States that prevent some companies from writing that, because companies started writing that just to cover themselves. Even if they were not made in a factory that had peanuts and tree nuts, companies were doing that just so that they never get sued. Unfortunately, in South Africa, we're not that advanced yet in terms of our legalities that we have. But those labels, for a mother who has a child, the minute you see anything that says may contain traces of, that's it. It's out of bounds for the child. Going out somewhere and you're not able to eat something, and then people get insulted. You know, you go out for dinner, you get invited, you travel overseas, you're and get invited to somebody's home for dinner, and then you're not able to eat something and offending people. Interrogating waiters, I can tell you this, mums feel this way all the time. Every time they go to a restaurant and even a birthday party, they feel like they're interrogating the mother who's hosting the party, because they're always asking, well, what's in the cupcakes? What's in the cake? Are you sure? How much of egg? Was it baked? Are there any peanuts? Did you have peanuts in your kitchen? Which bakery did you get it from? So you're constantly doing that, and that's what you have to live with. The teasing and people asking, can I eat this near you? And there's a flip side to this. It's not as funny as the slide makes it seem. The young kids actually get teased in their classrooms because kids who don't have the allergies think that the child with the allergy is now a mascot for allergy and someone that they can pick on. And I've had so many mums where we've had to go to the schools and do talks because the mums actually got called in, and kids throw peanuts at another child with allergies and says, let's see if we throw this on you, what's going to happen? Let's just see, are you going to blow up like a balloon? And often, especially older children, I would say from 10 onwards, they won't even come home and tell their mummies because they're so embarrassed, and they're at that stage in their life where their impression that they have in their classrooms and what their friends think of them is so important to them that they often hide, and they get bullied and they get teased at school. The EpiPen is another thing little kids get teased about because it looks like a weapon. I've had kids here in the Western Cape in some schools where the boys got together and they told the child with allergies, let's stab you and see what happens. And that EpiPen, which is 1,300 Rand, that's it. One stab, one prank, 1,300 Rand down the drain, and it's gone. And I mean, it's not about the money. It's actually a life-saving drug, which now is no longer there because it's been used. Kids who have to sit in separate areas. We don't have nut-free cafeterias yet in South Africa. In Europe and USA, it's definitely already a thing. But what is relevant here is nut-free areas at birthday parties and at socials, okay? As they grow older, having girlfriends and boyfriends and not being able to physically interact with them. Fortunately, COVID has solved this for us and the masks have, but not being able to interact, and this impacts them socially in such a huge way. Being like I said, a mascot where people all talk about your allergies and write about your allergies and, use you as that example. It's not nice for a teenager. The panic when you second guess whether you've eaten anything. So sometimes they eat something and they're not sure it might or might not taste like something that has peanut. Even if it doesn't, even if they don't react, the emotional anxiety and the trauma is still there. Lots of tasty things that everybody has, their future doesn't have that. And basically that people just don't understand how serious their allergies really are. Okay, I'm going to hand over back again to Lynn now, who's going to ask you or lead the Q&A session. Thank you so much for your attention so far.
Thulja, can you stop screen sharing? And then we can just see you.
Excellent.
Perfect. Okay. I'm sure that actually you've all learned an enormous amount, and we really thank Thulja for spending the evening with us, going through it. It really has been invaluable. Ask some questions. I will go through a few of them. If a child definitely has a cow's milk allergy, can they tolerate goat or sheep milk protein?
Yes. So it depends on how serious or severe the allergy is, and it depends on what the levels of those proteins are. So when we look at milk, there are two types of proteins in milk. You've got the whey and you've got the casein. And the casein is the one that's very specific to allergy. So sheep milk, yes, they can definitely tolerate it. But what's interesting is we found when we look at the milk proteins themselves, goat milk and cow's milk have lots of similarities in their protein itself. And that's why I said it depends on the child. So yes, they tolerate almond milk, they tolerate cashew milk because those are non-animal milks. More often than not, they would tolerate sheep milk, but the goat milk is always something that we assess because they're very, very similar. So when we put goat's milk protein and cow's milk protein under a microscope, we found that they were similar. And that's why we felt there's no point using goat's milk as a substitute if somebody has an allergy, because it's almost the same thing in terms of the protein structure. So that's the answer with regards to the goat. Sheep, yes, more of them would tolerate it.
Perfect. Another question. Before I ask the question, just to tell everybody that Your feedback forms have been sent to you. The link is also in the chat box, so you can start filling out those so long and sending them through while we are asking questions. Okay, where can I get the skin test done? And is there a certain age it should be done at?
Okay, so the skin test can actually be done from infancy. I do it from 4 months of age. Most of the commercial labs in South Africa do skin tests, but they don't do skin tests to the commercial, to the extracts themselves, like to the fresh milk and to the fresh peanut and maybe the fresh cashew nut or the scrambled egg itself. So what they would do is they would do a skin test to an extract in a bottle, which has the protein in it. So that's the reason why I often call the mummies. If you're worried, I call them and I do it with the extract, or I get them to do it with the extract, and I tell mom, bring some milk or bring some, and this is only because, like I said, it's COVID. I want you to bring it from home because we don't want contamination. But either the milk or the peanut butter jar from your home, or sometimes we would get the sachets, and we do the pricks ourselves on the skin. There are many doctors who have some experience in allergy. I'm sure if you check online, who've done diplomas in allergy, who do and are qualified in doing skin tests. But what they wouldn't do is the challenges, introducing the foods. You're welcome to contact me because I am, depending on which province you are, if you need just that guidance of introducing the foods into your baby's body, then, you know, we do the skin test on the day, and then if we're okay to go, we introduce the foods in. But most of the commercial labs do have the extracts.
Right. I will be starting solid soon. Is there any medication I can keep on hand in the case of an allergic reaction?
Yeah, so I always say Allergics is the best here, right? Over a period of time, we've got so many antihistamines now because the histamine molecule has been studied, and we've come up as the decades have gone with better and better antihistamines. As adults, we know this. You know, there's so many fancy ones if you go to the pharmacy, non-drowsy, non-this, non-that, and we use all of them. But when it comes to an acute reaction, I still use Allergics. And the reason for Allergics is that it works within 2 to 3 minutes. All the other antihistamines we use are great for our hay fever, and they're great for our hives and our itching and for our environmental allergies. But if you've got a child who has a swelling on the eye, swelling on the lip, something immediate that you worry about, you keep the Allergics at hand and you use it immediately.
Right. When my 7-year-old son laughs a lot, he starts to cough, but it's a loud whooping cough. Should I be concerned? He also has eczema.
Okay, so I'm not too sure about the relation with the laughing a lot, but if he has eczema, then he probably does have what I call an atopic profile. Eczema is the first part of that allergic march. Usually, I didn't show you a slide on that, but usually they start with eczema, then they get food allergy. After the food allergy, then they get the hay fever, and when we don't manage that, that can turn into asthma. So what happens with those kids with eczema, often if they don't have food allergy, maybe because their risk of food allergy was low, or you as a mom did all the right things and you introduced it so they don't have the food allergy, what happens with eczema is that increases the risk of environmental allergy. So that things in your environment, your dogs, cats, dust, grass, and when you have those allergies, that affects your upper airway, your nose. So it could be a sign of early hay fever or allergic rhinitis, why that cough is continuously coming if it's chronic, especially if there's eczema. The eczema itself could be driven by something in the environment, like dust mite allergy or pollen allergy.
If you never had food allergies, can you pick it up during pregnancy?
So not the main one, so not the milk, egg, the peanuts and tree nuts and wheat and soy, but seafood. And it's not a pregnancy thing, it's just an adult thing, right? But pregnancy would fall in that category. You can become allergic to seafood later on in life. And I have had moms, I wouldn't say who picked up a full-blown allergy where we've had to test it and completely avoid it. but I've had pregnant moms who suddenly got a bit more reactive to seafood while they were pregnant. And it usually started with some nausea. And then suddenly they said, you know, they get a bit itchy in their throat and stuff. And what I did is, because I know it's a short-lived thing and it's not going to cause any harm, and we don't want to make moms uncomfortable, is I eliminated the seafood just for that short period. And then we reintroduce it once pregnancy is over, if they tolerate it. If you're worried about reintroducing it after you've delivered your baby, then we do the blood test. We see, is that allergy a proper allergy? Now that your baby has been born, you're at a normal state. You're not at a state of being a pregnant woman. Is there a new food allergy? Has your levels increased? And then we take it from there.
Great. I think we'll call this one the last one. If mom is lactose intolerant, can she pass that allergy to the baby as well?
Yes. So remember, lactose intolerance, extremely uncommon in children, in infancy, right? So that's the first thing to be mindful of. But yes, intolerances and allergies do kind of, it's not the only factor, but they do have a hereditary component to it. So remember, we talked about high risk or at risk infants, and we said family history. Family history is very important because that does place an infant at increased risk of intolerances and with allergies themselves. There is a genetic component to even our gut enzymes, inflammatory bowel disease, autoimmune conditions. So it falls in that entire category. It doesn't mean that your child is going to have lactose intolerance, but their chances would be slightly higher.
Great, Thulja, that is wonderful. I think, would you like to leave some form of contact details for somebody who wants to come and have a consultation with you? How can they get hold of you if they want to consult with you?
Okay. So I'm going to leave my email address. I think that might be the quickest and easiest, and my Johannesburg and typing my own phone number incorrectly. My Cape Town and Johannesburg and Durban contact details. So I'm in Cape Town and I'm at the UCT Lung Institute. In Johannesburg, I'm at Sunning Hill Hospital. Okay, if anybody needs that. But I think if anyone emails me, I'm able to respond to them and, you know, give them more feedback. I know especially now lots of moms are anxious about going to hospitals. I'm mostly in hospitals. You know, we're able to do virtual talks and consultations as well.
Perfect, wonderful. Thank you so much, Thulja. And people out there, don't disappear. We're going to just do the giveaways and do the final thing with you. No. Let's see what is going on. Better. Okay, people, just to tell you about our next webinar, it's on Saturday, the 5th of June, 9 a.m. for the morning. It really is one of the highlights of the year for us. So really do actually come and join us. And Thulja has covered some of the risks and how to decrease them for your baby developing allergies. And I will be covering things including birth and breastfeeding, how to actually decrease allergies at the June one. So really, if you want to have a baby that cries less, sleeps better, has better brain development, the solutions are free. do come and join us on Saturday, the 5th of June. The July webinar is going to be on informed choices, birthing plans and decisions, and that's going to be on Friday, the 9th of July at 7 p.m. For all of these, you can book at thoughtfulchildbirth.coza. The August one is going to be on breastfeeding, all you need to know, and that's going to be on Sunday, the 1st of August at 7 p.m. The September one is going to be looking how to look after a sick child and when to call the doctor, what you can do at home practically, and that's going to be on Friday, the 3rd of September on 7 p.m. as well. So if you haven't already, please fill out the feedback forms. It's important to us. It also makes you eligible to win giveaways, and you get your certification to being a mom and dad. This is what the certificate will look like that you actually receive. Okay, so the first let's see, Tammy, are you there and available to go through the app?
Yes, I am. Give me about 10 seconds, please. Okay, so can you all see my screen?
Yes, we can.
Sorry, just having a technical difficulty. Gonna try this once more.
Do you want to win the food?
Len, I don't know if you perhaps want to go ahead with maybe one winner so long.
Perfect. Okay, I'll just need to. Okay, so the first person who's going to win a consult is Frances Berger. Okay, and she will have a consult on choices, planning your pregnancy at birth, making decisions. So if you can actually, Frances, put your contact details in the chat box, then I will be able to follow up and contact you. We've just been doing a Huggies giveaway on our social media platforms on Facebook and Instagram, and we're announcing the winner of that tonight, and that is Botlale Ramarula, and she is the lucky winner of the hamper. There is going to be a new surprise giveaway that starts tomorrow on Facebook and Instagram, so do go and check it out so that you might be the lucky winner at the end of the month. Natura has put together a hamper which includes the most loved all Natura mom and baby products to the value of $650, and that is the explanation of what is in the hamper, and that winner goes to Mahali Manyaneng. And Mahali, if you can put your contact details in the chat box, that is great. I see Tammy is ready, so we'll stop sharing. Okay, Tam?
Okay, let's try this again. Thanks for being patient. Can you all see my screen?
Yep.
Okay, great. I hope you guys have enjoyed the webinar so far, and I really do hope that we see you at future webinars. So when you click on the Expectant Mother's Guide Journey app, this is really the home screen. The slides at the top kind of just interchange between Thoughtful Childbirth and reminding you that it's available on all digital platforms. So if you move down, we've got the Expectant Mother's Guide, which is a folder. You can click on it. Internet outside's a little bit slow, so please bear with me. Let me try and put it on the Wi-Fi quickly and see if that makes a difference. Okay, yes, there we go. Should have been on the Wi-Fi. So we clicked on the Expectant Father's Guide. We've got a few articles. If you click on the very first folder, it will take you to the actual Expectant Father's Guide magazine for 2021. And then a little bit about further folders, for dad, you and a pregnancy, dealing with things around dad's involvement, the 12 dad verbs, some videos, and then also a section on you and your baby, that's for dad. If we go to the Expectant Mother's Guide, 2021 Expectant Mother's Guide, you'll be able to read the digital magazine online. Then we've got you and your pregnancy, so everything relating to mom and her pregnancy is in the next folder. About your birth, the same. Calculators, I don't know about you, I was quite interested in these calculators. So those are quite a nice tool. Tracking your pregnancy, the news, our 2 Mommy newsletters, Wonders of Breastfeeding, you and your baby, and a hospital bag packing list. That was also very handy. Thoughtful Childbirth webinars, just quickly. So here we've got them listed. We keep them, I'm just waiting for it to load. There we go. You can kind of click on any one of those and it will link you to either the relevant folder or to the form for you to sign up and attend for those ones. Exercise, if you're following or looking for online exercise platforms, this is where you can come in and have a look. I don't know about you guys, but I also wasn't too keen on going out and exposing myself to any of COVID or those things, so that's quite handy. Q&As, if you've got any questions, we've got a panel of professionals that are available and ready to answer your questions. You can just post your question and the relevant professionals will answer your questions. List of childbirth educators, just quickly, if you're looking for a childbirth educator or a lactation consultant or a private hospital in your area, click on any one of those that interest you. And make sure your location is turned on and it will list them, those that are directly around you. And there you can get all their details. If you click on it, you'll get their details, their email addresses, contact information. Same with the lactation consultants, private hospitals, and support group and helpline numbers. Just a few places you can shop online for baby essentials, a list of all the baby stores, Ackerman stores, Babies R Us, Baby Boom. Those are all maps that you can click on and see which is closest to you, and then some of the online platforms as well. Health and nutrition, and then topics of the week. So in a nutshell, that's our app. So yes, if you guys have any questions, you're welcome to pop us a WhatsApp or an email. And those competition runners, just quickly, you're welcome to send through your details on the WhatsApp number that's where you've received all the communication from as well. That will be great. Perfect. Thanks, Lynn.
Thanks. If you can stop sharing. Thank you. Okay, Epimex is giving our mommy hamper valued at R1,000, and that one goes to Ashley Bird. So if Ashley, you can put your contact details, your physical address, cell number, etc., so that we can get that off so they can send you your hamper. The next Huggies hamper goes to Larissa and Tommy. So again, Larissa and Tommy, if you can put your details in the chat box. Another Epimex hamper valued at R1,000 to Kaylin Mayer. Also put your details in for us. Another consult is going to Melisha Naidu. So Melisha, put your details in. The second Huggies hamper goes to Lisa Dube. Lisa, put your details in. Oh, and we need to find one more winner here. For the Epimex is Mashudu Rambau. It's called Have a Stunning Evening. See you next time. Hope you've really, really enjoyed yourself and learned lots. Go and enjoy your pregnancy. Go and birth wonderfully. And we hope to see you in June. Cheers.